How are you coping? Everything feels like it's topsy-turvy at the moment. Things you can do, things you can't do. You might be okay to keep going about your life, but maybe friends and family might be a little bit more restricted. It's a lot to deal with, and it can really take its toll. You may never have dealt with feelings like this before, and that's fine, but what you do need to know is that you don't have to do it by yourself. FocusOne Health have many different services available to get you through whatever you're facing in what we have all heard are unprecedented times. Philip Galley is a clinical services lead with FocusOne Health in the Riverland. Philip, good morning.
Good morning, Matt. How are you today?
I'm all right, thank you. Has there been an increase in the number of people accessing services over the past, 6 or 7 months or so?
I wouldn't say so much the last 6 or 7 months, definitely the last 3 months, Matt.
Right, okay.
Some of that's been as the fallout of COVID-19 and the various restrictions and impact on people's lives has started to become more clear to people in terms of what it's doing to them or what it feels like it's doing to them. We've definitely seen quite a significant increase in referrals to our mental health, less so our drug and alcohol services, but definitely our mental health services in the last 3 months.
Well, I suppose that's if drug and alcohol are falling off a little bit there, that's a good start, I suppose. But what in particular, you say mental health, but what in particular are they wanting help with?
I think people struggle with anxiety about, you just used the word unprecedented times, which is a bit of a hackneyed phrase over recent months.
Yeah, we try and avoid that if we can, but
It's certainly true, and people find, things I used to be able to rely on and even just took for granted, now I cannot take them for granted, and that's causing me to feel uneasy, that's causing me to feel frightened, that's causing me to have panic attacks, that's causing me to feel overwhelmed. So presentations to GPs, I would say, are certainly increasing for those kinds of reasons, as well as, throw in the financial uncertainty, throw in the inability to visit relatives or loved ones or attend funerals across the border or whatever it might be. And the world feels like a very uncertain place for a lot of people these days.
Philip Galley with us this morning from FocusOne Health. Philip is the clinical services lead there. So someone goes to the doctor and then they get a referral to FocusOne Health. So how can you help?
There's a number of ways we can and do help, Matt. Depression, for example, I once heard a psychiatrist say it's a bit like somebody presenting in an emergency department with breathlessness. The medics don't, treat the breathlessness as such. They try and work out what's sitting behind the breathlessness. What are the systems that are impaired that are causing the breathlessness? And then you treat those impaired systems. So for some people, medication might be the first line for them, in which case a good relationship with their GP, along with a bit of support from us in terms of what to expect in terms of side effects and how long to be on the medication, the time of day to take it, that kind of thing, is adequate for some people. For other people, for a whole variety of good reasons, they don't want medication to be the first line. They want to take the opportunity to unpack some stuff from historically in their lives, or, dating right back to childhood, or issues they've always kind of grappled with, and now they're finding the lids off everything, and it's time to seek help. I sat with a bloke yesterday who was reflecting on the fact that it was a year ago almost to the day that he'd presented first at his GP. 3 months later, he ended up in hospital, and the trajectory from there, when he came out and connected with our service, has been a very, very positive one, because his relational life, some of the long-term grief issues from his life, 2 broken marriages, and shift work out in the Pines where he's up at 2:00 in the morning and things like that. All of that kind of stuff was taking its toll on him, and he needed support. He needed somebody to interact with over a period of some months while he made some quite significant life decisions. And so many of our health services today aren't set up for that kind of thing, whereas thankfully FocusOne Health is.
Yeah. Philip Galley this morning from FocusOne Health, the clinical services lead there. So there's another issue here as well. What can you do to get past the resistance people might have to actually go and talk to someone to start with?
Yeah, I mean, everybody feels a bit reticent, and there are a number of things we can address with that. We have a team of triage nurses who, when we receive a referral from a GP, as you know, GPs are time poor when it comes to seeing people and unpacking mental health problems. So our triage nurses will make an appointment with a person at their convenience, that is the client's convenience, not the triage nurse's convenience, over the phone. And sometimes that first voice, very reassuring, very knowledgeable, that sense of, oh yeah, this is normal. This is what some health professionals do. Really starts to put people at their ease. Gives people the opportunity to ask questions about what it's going to be when they meet with somebody face to face. I mean, we don't have to have face to face appointments. COVID-19 has paved the way for more telehealth delivery of services and such like.
Sure.
But I think the idea of talking to a complete stranger, for some people, that's helpful, because no two human beings are the same. But for many people, it's quite difficult. It's quite difficult to contemplate.
Yeah.
Whereas once people get into the building and sit quietly in an office with somebody who clearly knows what they're doing and is a good listener and is going to be there for the hard yards over the next few months, a lot of that reticence, a lot of that stigma just starts to fall away. Oh, this feels totally normal.
Yeah, and it helps with the progress as well. We're just about to bump in the news, but I do want to ask, we've talked about doctors' referrals. Is that required to go to FocusOne Health to get your services?
For most of our services, it is. For our drug and alcohol services, we don't require a GP referral for obvious reasons. There can be many reasons why people don't want to talk to a doctor about substance use. And we also have a low-intensity cognitive behaviour therapy, which is a bit of a mouthful. So a bit of a coaching program, really, that doesn't require a GP mental health treatment plan.
Okay, so maybe the first step is to see your GP and then work from there.
Absolutely, Matt. That's a good first step.
Sounds good.
Or if for whatever reason you haven't got a doctor, just ring FocusOne up and somebody will be there to assist and talk you through what options would be available for you. Excellent.
All right. Philip, good to chat and I really appreciate your time this morning.
Thanks, Matt. Thanks for the opportunity.
Philip Galley, Clinical Services Lead with FocusOne Health. Don't be afraid to get help. Don't ever be afraid to ask for help. It really is a good thing. And if this story has raised any issues for you, as we say, you can call FocusOne or you can call Lifeline on 13 11 14 or Beyond Blue on 1300 22 46 36.